Happy Migraine Awareness Month, everyone. Hope you're enjoying everything that we've done for you so far. Now, if you watched the interview where Flynn interviewed me in one of our Meet the Team interviews, you would have seen me talking about the trouble that I had with incontinence as a child and how we don't talk about that as much as we probably should as a symptom of migraine. Frequency of urination is a pretty common symptom. You'll see that pop up in the Migraine Australia chat group from time to time, but we don't talk about incontinence very much. So to help me do that, I have Janie Thompson, who is the Clinical Services Director for the Continence Foundation of Australia. Thanks for joining us, Janie.
Thank you. Thanks for having me.
Now, incontinence is a really common problem in Australia, isn't it?
Yes, we're looking at about 1 in 4 people experiencing incontinence over the age of 15, so it's extremely common.
Okay, so now we know that migraine can do all kinds of crazy things to the body, but outside of kind of migraine, and particularly the prodrome phase of migraine, where we have that frequency of urination, what kind of things generally cause incontinence?
Incontinence is a symptom of a problem, so there can be lots of causes, and you've already alluded to migraines being potentially a cause. Mm-hmm. So there can be lots of reasons as to why someone might have incontinence, such as having a stroke, diabetes, dementia, childbirth, constipation, prostate enlargement, prostate surgery. So it's pretty much any part of your body could potentially result in someone having incontinence, and at any age.
Mm-hmm. So are there particular things? I mean, most of us are kind of working age women, and obviously that means we're talking about a lot of people that have reasonably recently had babies or are in that kind of phase of their life. They obviously get the pelvic floor lessons. I think a lot of us have had. Yeah. Hopefully, yes. Yeah. Is that like a big factor, the pelvic floor strength?
Yes, so your pelvic floor is really important for both men and women in helping maintain or improve continence. And it's also important to allow you to wee and poo, basically. So your pelvic floor supports your bowel, your bladder, and also your vagina for women. So your pelvic organs and your gastrointestinal tract and your urinary tract are all supported by the pelvic floor. So having a good, well-working, strong pelvic floor is really important, and also one that relaxes appropriately when you wee and poo. Sorry about the big graphic terminology.
This is the topic, right? We've got to talk about it.
Okay, good. So it's really important that people are aware of their pelvic floor and look after their pelvic floor, and particularly for women who are pregnant or having children, there's an increased risk of weakness to the pelvic floor. So it's really important that women are aware when they're pregnant and then post-childbirth, they work on their pelvic floor.
Okay, and migraine just kind of makes that a little bit more complicated because it does things like weaken our muscles or just send off crazy nerve instructions to parts of our body to do something it shouldn't do, which is just excellent fun. All right, what support services are available for people who are dealing with incontinence?
So I'm part of my role is to manage the National Continence Helpline, which is a Monday to Friday helpline available from 8 a.m. till 8 p.m. and it's manned by nurse continence specialists. My background is a nurse continence specialist as well. So they're nurses with postgraduate qualifications and experience in continence. So people can ring up and get advice. We then will often provide information on local services that a person could see to help see a health professional about their problem, as well as general advice on, good bladder and bowel habits, product information if they want to wear some sort of product to help keep themselves comfortable. So we deal with people of all ages, from, talking to parents about young children, women pre and post childbirth, men who've had prostate surgery, carers looking after someone with a disability, or, if their partner might be older and have health issues. So it's a good first start, but there are lots of continence services and continence professionals around, such as continence services that have nurses, pelvic floor physiotherapists, and medical teams such as geriatricians or age doctors, urologists, gastroenterologists. There are also single service clinics such as pelvic floor physiotherapists who have a special interest in the pelvic floor and pelvic floor rehabilitation, as well as nurse continence specialists who often work in the NDIS field and support people with continence assessments.
Okay, so what would be your number one tip for people with migraine who are possibly experiencing a little bit of incontinence? What should they do?
I would suggest you have it looked at. So, it can be that prodroma sort of symptom that there is a headache or migraine coming on. but maybe there's more to it than that. So don't just assume that that's the only reason. It might be exacerbated by your migraine, but you should still investigate it just to make sure there's something that could be done to improve it. And even if it is a precursor to your migraine, having the skills to, for example, learn how to use your pelvic floor, how to relax your bladder, how to hang on better when you do feel like you have to rush a lot to the toilet will give you a bit more confidence when you do actually experience that. So there's things you can do to improve it and be more conscious of its relationship to the migraines, and also make sure that there isn't other factors contributing to it. The same with constipation being a precursor to a migraine, just, making sure that you have a good pattern with your bowels, that you eat well, that you know how to sit on the toilet correctly, because there is a special technique that you should be using on the toilet, that you make sure you're relaxing well when you try and use your bowels. And also too, both any incontinence and constipation are going to have sort of a longer term effect. So particularly if you don't manage your constipation leading up to a migraine, you could have ongoing issues with constipation afterwards as well. So it's really important that you keep on top of these things.
That's such fantastic advice. And I'm sure everybody that is experiencing the continence side effects of some of the new CGRP medications will be interested in that information as well. Constipation side effects, which is affecting quite a number of our members. We'll put up links to the Continence Foundation website and your 1-800 helpline, which I think will be really great. And also enjoy or have a great World Continence Week, which is June 21 to 27, while we're doing Migraine Awareness Month at the same time. Yeah, so you've got a particular focus on men with incontinence this year.
Yes. This year, our big campaign is around bins for blokes. As you're probably aware, as a woman, you are aware that there are sanitary bins or disposal bins in toilets, but not so for men, and men still experience incontinence and do wear continence products. So we're trying to have a push that public toilets especially, and also even in private businesses, that people think about having a bin available for men as well. And it's been really actively uptaken, particularly with local city councils sort of acknowledging that we do have many men in Australia who need to wear continence products and struggle to know where to dispose of them if they need to change their products when they're out. So that's our big focus this year, and men's health in general as well, because men are less inclined to have health-seeking behaviours than compared to women. So we really want to encourage men to actually call the helpline, for example, because the majority of our callers are women, and often they're calling about their husbands. So it'd be nice to see that or partners, I should say, it'd be nice to see that the men actually make the call about themselves instead.
That's a fantastic initiative that you've got there. Hopefully we do get lots of bins for blokes all across the country. And definitely, yes, guys, talk to your doctors, call the helplines. They are there. For migraine, continence, doesn't matter, do both. Thank you so much, Janie.
No worries. Thanks for having me.